Good afternoon, everyone. My name is Wendy Wright, and I'm a dual-certified adult and family nurse practitioner. I'm here at the CARPS conference here in Orlando. The purpose of this little video is to give you 3 big takeaway points. So the first point I'd like to share with you from my lecture is that in January of 2016, the CDC came out with recommendations to help us as clinicians to recognize who needs antimicrobial therapy and who doesn't. And the big takeaway message is that acute bronchitis is almost always viral. At least 90+% is viral, yet it remains in this country the #1 reason to be given antibiotics as an adult. So I hope that you will recognize that the majority of your patients who come in with an upper respiratory infection, cough, sputum production, upper respiratory infection like the common cold, the majority of them do not need antibiotics. Despite these recommendations on antimicrobial stewardship and reducing utilization, we continue to prescribe for at least 40 to 50% of all people that come in with bronchitis. So I hope this takeaway message will help you to curb that desire or need to prescribe for these patients. My second takeaway message has to do with COPD. We're seeing that the numbers of COPD have gone up more than 180% in the last 20 years. And these patients with COPD, there are more than 28 million of them, are developing what are called acute exacerbations of chronic bronchitis. These are patients who already have underlying airway and lung disease who are coming in with what are called the 3 cardinal symptoms of a COPD exacerbation. And that is increasing sputum production, increasing purulence to that sputum, and increasing dyspnea or shortness of breath. Those patients with those 3 cardinal symptoms are in need of antibiotics if they have underlying COPD. That's a real appropriate place to use antibiotics. The last takeaway message I'd like you to leave with is that there are some new blood tests that are being looked at, one being CRP. And we've used CRP for years. It's an inflammatory marker. But if that CRP is greater than 50, there are a couple of trials now that show us that it's more likely to be a bacterial infection, hence warranting antibiotics. The second is a blood test called procalcitonin. And that procalcitonin, there's a whole spectrum of what constitutes elevated or not, but just suffice it to say that an elevated procalcitonin signals the need for antimicrobial therapy. So stay tuned for this evolving research to help us as clinicians that are in those exam rooms to figure out who truly needs to be given an antibiotic and who can we feel safe in riding out these infections in. Thank you for allowing me to join you today.